Phlebotomy Certification Practice Test 2025 NEW Updated 25 Questions Answers. Question 1. What is the purpose of the tourniquet? Stop arterial flow, enlarge the veins, prevent infection, identify the patient. It slows venous return, making veins prominent. Question 2. The correct order of draw starts with red, lavender, blood cultures, green. Cultures come first to prevent contamination. Question 3. Blood cultures are typically drawn in sets of 1, 2 aerobic and anaerobic, 3, 4. To detect different types of bacteria. Question 4. Applying the tourniquet for too long causes hemostasis, hena concentration, hematoma, hypoxia. It alters the concentration of blood components. Question 5. Which finger is preferred for capillary puncture? Thumb, index, middle or ring, pinky. Middle or ring fingers are standard. Question 6. Which tube is used for coagulation tests like PT/INR? Light blue, red, gray, tiger top. Light blue contains sodium citrate. Question 7. What is the first step in patient identification? Check the armband. Ask the patient to state their name. Look at the chart. Ask the nurse. Two-factor ID is standard. Question 8. What does NPO mean? New patient only. Nothing by mouth. Normal pulse only. No blood draw. Patient should not eat or drink. Question 9. The SSD tube stands for simple serum tube, serum separator tube, single source tube, sodium salt tube. Contains a gel to separate serum. Question 10. The butterfly needle is also known as straight needle, winged infusion set, vacutainer, lancet. Used for fragile or small veins. Question 11. Specimen labeling should happen before the draw, in the lab, immediately after the draw at the bedside, at the end of the shift. Always label in the presence of the patient. Question 12. Which additive is in a lavender tube? Heparin, EDTA, citrate, oxalate. EDTA is the anticoagulant for CBCs. Question 13. A hematoma is caused by too much suction, blood leaking into tissue, clean needle, fast draw. Commonly known as a bruise. Question 14. A timed test like glucose tolerance requires random collection, strict timing of samples, morning collection only, fasting for 24 hours. Samples are taken at specific intervals. Question 15. Syncope is the medical term for bleeding, fainting, nausea, pain. A common reaction to blood draws. Question 16. The order of draw prevents patient pain, cross-contamination of additives, clotting, hemolysis. Additives from one tube can affect results in the next. Question 17. How many times should an EDTA tube be inverted? 1-2, 3-4, 8-10, 20. Proper mixing prevents microclots. Question 18. The most common vein for venipuncture is basilic, cephalic, median cubital, radial. It is large and well anchored. Question 19. Hemolysis is the clotting of blood, destruction of red blood cells, fainting of patient, infection at site. Can be caused by shaking tubes or small needles. Question 20. The gauge of the needle refers to the length, the diameter of the bore, the color of the hub, the material. Larger numbers mean smaller diameters.